Hello, cat and feline medicine lovers. Welcome to our Feline Perfect podcast. Here you will find news and essential information for the well-being of cats. Grab your headphones and relax for another episode.
Hello everyone, welcome to another episode of our podcast. Today, we're diving into a topic that challenges many of us in the clinic, feline lower urinary tract diseases, or FLUTD. And to guide us, we'll use the 2025 consensus guidelines, which bring several new developments in treatment. FLUTD is like a puzzle, with several pieces that fit together, but which can have different causes: dysuria, hematuria, periuria, polyuria, and stranguria. All these signs can indicate a problem in our feline patient's urinary tract, and the 2025 guidelines emphasize a comprehensive diagnostic approach to unravel this mystery. We start with a good conversation with the owner, a detailed anamnesis. We need to know everything about the cat's diet, environment, stress history, and social interactions. It's like investigating a crime scene. Every detail can be crucial. Next, we move on to the physical exam. We assess the weight, muscle condition, and palpate the bladder and kidneys. In older cats, we can't forget to palpate the thyroid. Then, urinalysis, which is like a blood test for the urine. Ideally, we collect a sample by cystocentesis, but samples collected at home with non-absorbent litter can also be used. And we can't forget about the bacterial culture to rule out infections. If we need more information, we can use imaging. Radiographs and ultrasounds help us identify uroliths, masses, or other abnormalities. Radiography is especially useful for detecting radiopaque uroliths in cases of urethral obstruction. And when we rule out other causes and arrive at the diagnosis of Feline Idiopathic Cystitis, or FIC, the 2025 guidelines recognize FIC as a systemic disorder influenced by neurological, endocrine, and immunological factors. Stress plays a crucial role, and multimodal environmental modification, or MEMo, is essential in treatment. MEMo is like creating a spa for the cat, a calm and safe environment where they feel comfortable. This includes increasing the number of litter boxes, providing safe and elevated resting areas, enriching the environment with toys and games, ensuring access to fresh water, and reducing social stress. And we can't forget about analgesia. Prioritizing pain relief is essential. We can use NSAIDs, opioids, gabapentin, pregabalin, or even anti-NGF monoclonal antibodies, although the latter have not yet been studied in non-obstructive cases of FIC. Nutritional considerations are also important. Ask the owner what diet the cat prefers and suggest buying a few different brands to offer the cat in order to assess their preferences and give them a choice. And pay attention, prednisolone, pentosan polysulfate sodium, and glycosaminoglycans have not shown significant benefit in cats with FIC. Amitriptyline may be considered in refractory cases, and fluoxetine may decrease urine marking. If we identify urolithiasis, it is appropriate to try to remove the uroliths for analysis. Dietary trends influence the types of uroliths, and recent studies suggest that struvite is now more common than calcium oxalate. UTIs are uncommon in healthy adult cats, but more prevalent in cats with CKD or over 10 years old. Diagnosis requires bacterial culture, and antibiotic treatment should be based on sensitivity testing. And remember, antimicrobial treatment of subclinical bacteriuria is generally not recommended. Urethral obstruction is a life-threatening emergency that requires immediate intervention. Treatment involves stabilizing the patient, relieving the obstruction with a urinary catheter and fluid therapy. Analgesia is a priority, using opioids or epidural anesthesia. A sacrococcygeal epidural block with bupivacaine, lidocaine, or a combination of bupivacaine, morphine provides local analgesia and can reduce propofol requirements. Use atraumatic catheters and consider smaller diameter catheters to reduce the risk of urethral trauma and UO recurrence. Prazosin administration is generally not recommended based on current evidence. Closely monitor serum electrolytes and acid-base balance. For fluid therapy is the fastest way to lower potassium concentrations. And don't forget to create a cat-friendly hospital environment, reducing stress during hospitalization. In cases of suspected urethral spasm, with minimal biochemical changes and normal abdominal radiographs, we can try a protocol with sedation, analgesia, subcutaneous fluids, decompressive cystocentesis, a low-stress environment, and penile massage. However, this protocol is not suitable if there is a continuous physical obstruction. In one study, more than 70% of cats were able to urinate spontaneously in less than 72 hours with this protocol. However, it is crucial to note that this protocol is not suitable if there is a continuous physical obstruction, such as urolithiasis, which cannot be ruled out without catheterization. Although this protocol is economical, it will not be successful in the presence of continuous physical obstruction. And finally, the 2025 guidelines emphasize the importance of the owner's role in managing flood day. Effective communication with owners is vital to ensure adherence to treatment recommendations. Adopt an open, attentive, and empathetic communication style and address aspects related to the cat's environmental needs. With these guidelines in mind, we can offer more effective and compassionate treatment for our feline patients with FLUTD. Thank you for joining us on this episode. See you next time.